just so that you guys know, my name's Peter Mabbutt. I'm the Director of Studies, and Dr. Sumithra.
Welcome. Thank you for participating in this. And let's see what we can get to know here today. Yes, about CBT.
CBT itself is pretty much a game changer. It emerged at a time when psychotherapy was going through a bit of a change. Psychoanalysis was the main therapeutic process that was being used for a very, very long time. And when we hit the Vietnam War and the veterans were coming out of the Vietnam War, we realized that there was a need to basically provide a different structure to therapy. People didn't have the opportunity to spend long time in therapy and to overcome their issues. And so there was a search on basically for a brief and very structured approach to therapy that was very, very effective. And CBT came out of the behavioural therapies. Basically, it came from the behavioural therapies, a more direct, a bigger approach to being able to do something in the immediate and in the here and the now, as opposed to the perhaps more introspective element that's in psychoanalysis. CBT is a very, very research-oriented or research-based approach. There are many different research protocols out there that's showing the efficacy of CBT. There are lots of research approaches that show the efficacy of other psychotherapies. But research has been going on, and certainly with something like CBT, we're now understanding this thing called plasticity of the brain, which is basically how the brain can start to change within itself in response to different ways of thinking, different ways of wanting to carry out various elements that we go through each and every day. There's even a rewiring that we can now see that comes in, where neurogenesis is referred to, are beginning to be seen to rewire how we're responding to anxiety, to responding to depression and to stress. And it even goes down to a genetic level with this area called epigenetics. We don't change the genes, but we can change the way in which the genes will work. And over time, and the strong research base to CBT, it's been recommended by many global health organizations. And there's just three there, just as a start. There's many more. There's the National Health Service here in the UK. There's the American Psychiatric Association, World Health Organization. And from its popularity and the fact that it is brief, it is structured, and it is effective, it's being increasingly used in hospitals as therapy. That's what it was first created to do. It's been brought into things like coaching, also leadership. People in business are taking on its principles and working with it. It's also being used in schools as well. It is an excellent framework and provides a wonderful framework, a wonderful position to put yourselves in professionally if you're introducing approaches that come from CBT, as it is a recognized model and it does what it says on the can. It's not just for our clients, it's also an excellent approach and a model for managing our own lives. We can bring it in to our own lives as human beings. You've got a big element here where we are empowering. There's opening up opportunities for reaching a wider range of people and being able to give more diverse services to clients, and just being able to reduce the amount of time that somebody may be spending within therapy. There are essentially 5 core models within CBT. There are many different psychotherapies that are out there. We're looking at approaches where, from the behavioural therapy approaches, they started very much looking at changing behaviour. CBT became known because, yes, behaviorism worked really, really well, but in those days it wasn't seen to work on our cognitions in the early days. And so Beck, Ellis and others came along and through the evolution of CBT, started to bring in not just the element of behavior, but also the role that behavior has in shaping our thoughts, shaping our emotions, and the other way round. Over time, two primary models did come about. There was the Beck's model and the Ellis model. Ellis's model is sometimes referred to as REBT, rational emotive behavioral therapy, because essentially what was happening there with REBT, it was looking at being able to challenge the irrational thoughts and bringing in a rational element to the process of therapy. And so we have the traditional cognitive approaches, which kind of focused on identifying and working with the automatic negative thoughts that kind of shape our reality and the way in which we interact with our reality and our emotional well-being. REBT, which brought a rational component into that, looking at the irrational thoughts that we quite often work by unconsciously, and bringing in a rational element to be able to challenge those thoughts. Then we have essentially the mindfulness-based cognitive therapies, where there was a more perhaps spiritual aspect that was starting to come in. We have it's very much about being present and in the moment and being able to observe our thoughts in a very non-judgmental way. And the schema therapy, which looks at identifying and working with the core beliefs that were formed in childhood that we then continue to bring into more formative years and then into adulthood. And also behavioral activation therapy looks at, amongst other things, breaking cycles. For example, the cycle of depression, being able to break that cycle of depression by engaging in more positive activities, more positive behaviors. There are many others out there. CBT came along, the third wave, and now the fourth wave therapies are coming along. Fourth wave are much more considered to be more spiritually oriented. But the key message with CBT is it's a power to reshape negative beliefs into empowering ones. So it's taking control of those thoughts that disempower us and bringing about empowerment. So, it's very, very brief element of this. What we work with in the LSCCH-LCCH is we work with the CBT with Ellis's model within the REBT element of it. And as part of that, there is this whole thing called the ABC model, which goes into the ABCDE model. Pretty amazing breakthrough within the whole concept of CBT and the way in which we we are empowered to restructure thought patterns. And what I'm going to do is I'm going to hand over to Dr. Sumithra, who will talk to you about the ABCDE model.
Hello, welcome everybody. And I'm just going to give you a very brief idea about what happens when you do REBT with your clients. So this model of ABCDE, it is a model, very elegant, very powerful, very effective, well-researched, and extremely popular. And so the whole process of REBT treatment is based on this ABCDE model. And this is the most important protocol of doing REBT. The idea of this whole model is to take your client through a very active directive process of therapy, where the client is very much involved, has to be involved. And through this process, there is a cognitive restructuring that happens, a changing of thought patterns. So when you look at the ABC model, it is that when things happen in life, if they are disturbing, they are called activating events. It can be something negative that happened. You had a bad day. Someone, scolded you in traffic. Your boss said something at work, anything, or in a relationship. There is an activating event that will cause, in our own words, that we are getting disturbed about. But when you look at the ABC model, there is a B in between. This is the belief your client or you will get when you look at that activating event. What your thought patterns, what do you think about it? And that particular belief, thoughts cause beliefs, and those beliefs are the ones that give rise to the disturbance at sea, which is a consequence of the whole thing. So when some activating event happens, you got some negative event happen, and you have a belief about that. Let us say I must be terrible at my job. That is why I got this bad comment at work. And this particular belief is what going to cause the anxiety, the self-doubt, and eventually the maladaptive behaviors like avoidance. ABC model explains that you are responsible for your emotions, and the activating event caused a belief in you, and that belief, which is yours, is causing the disturbance. So once we find these three elements, A, B, and C, we find those beliefs that I must be terrible at my job, or any other beliefs, that many beliefs can be associated. And all those beliefs will be questioned. Is this belief really true? Is it really causing you this disturbance? Is it logical for you to have this belief? Is it pragmatic? Has it been proven that this belief is what is causing you? Any of those, we will go on a path of disputation of what those beliefs are that the client is holding, which we know the beliefs are causing the problem for your client. Through this disputation, again, we also find a better way of responding, better way of thinking, changing your belief to a more healthier, other than I must be terrible at my job. But we teach the client how to change those beliefs into healthy beliefs. When you change that belief into a healthy belief, that will cause the disturbance to be lesser, and you will be completely in control of the situation instead of getting overwhelmed and becoming either anxious, any other kind of negative emotions. Once this is done, we are taking those effective beliefs that we taught our clients, which are more rational, and then we take those beliefs and integrate all those healthy beliefs into the client's belief system. Like, one comment doesn't define my skills. Someone make that comment that you're not good, your work is not good. But that one comment doesn't define me. I am much more than that. So with the effective belief incorporated or integrated into the client's system, that will make the client feel better, be better, and the client can go forward in life. And also the teachings that are done during this ABCD process, the client will also learn how to handle any other disturbance that may come along in life, because we all have different kinds of difficulties that we go through almost every day. Some we can handle without a problem, but some will disturb beyond our control. So when that happens, even in another time, after they're going through this therapy once, your client can handle life events so much better than before. When people have thoughts, when we have thoughts, thoughts cause beliefs, and thoughts also cause feelings, and then they give rise to behaviors. During an event, your thoughts are unhealthy or negative, they give rise to unhealthy feelings or negative feelings, and those feelings cause maladaptive behaviors in the client and also a lot of disturbance. So thoughts, feelings, behaviors, and this goes in a cycle reinforcing each other. And once the protocol, you have taken your client through this particular ABCDE model, then thinking changes, a lot of cognitive restructuring will happen, thinking transforms, and this will change the client's life. Think about this particular technique that is used in REBT, that this is called the 100 people technique. Let us say a client who's coming and telling you that my father makes me angry, and we always fight, end up arguing every time we meet. What that means is this person is, his meaning is the father makes him angry. If you ask, let us say there are 100 men of similar age, similar background to this person, have a father also. who is behaving more or less like this, do all those 100 people will feel exactly the same? Most of the time, what happens is some people may deny in that anxiety state, but very often when you give them time to think, they understand that most people would behave this way. Most people would get angry. And then you ask, what would the other people feel? What emotions can they feel? Although we never think about these things in real life, but take a moment and think about it and see. So, what other people think, some percentage will think it is, I get angry. Another percentage will think, oh, I'm very sad about it. Another person will become depressed about this whole event with the father. Or some people even will think it as a really amusing thing. So when you ask this, you can identify so many different emotions for the same event that the person goes through. That shows that the most important thing about this exercise is that we are responsible for our emotions. And you can think about it and see about any event in your life which you had a negative emotion. Think about it and see what if every 100 people will they go through the same emotion if they are put through this whole process of having this kind of events or difficulties. These are my cases which I used REBT. One client is an adult educated client, but he had severe social anxiety, social phobia. He could not for quite some time and he could not get over it, and he has come for therapy. I thought for this particular client, REBT will be good. After taking the history, we identified what are these negative thought patterns. We had many. This is what you're going to do when you are also treating a client, identifying the negative thought patterns. His negative thought patterns were, I am not smart enough to talk with people. Everybody else knows better than me. They will think I am really stupid because I may say the wrong thing. If they think I'm stupid, then I'm stupid. This damning sort of prevented him from going and seeing anyone, going any kind of social functions, no friends, nobody. And this made him practice avoidance. And that is a very maladaptive behavioral pattern. So then we identified all these and we took all these beliefs through the process of REBT, and we found what is a better way, what is a rational way of thinking to get over this disturbance that is going on of social anxiety. How would he get it down, and how would he be able to go and meet people in a more healthier and adaptive way? So we worked through that, this person, and then he realized that the irrational beliefs, all those beliefs that he had, were what preventing him from going and seeing people and socializing. So everything was disputed. And then once these thought patterns were disputed, we found out what are the better or healthier beliefs that he should be having. And we integrated all that through the process of, we call integrating of new and effective beliefs into the client's belief system. And he got through it, and he reported that he even hosted dinners for people, and he was very, very comfortable with going and meeting people. So this is one of the cases. And another case was performance anxiety. She had a bad experience in the past while giving some talk. So she started having the performance anxiety. She also had body symptoms of palpitations and jitters and tremors and sweating and all that when she had to give a presentation. We again found out what these thoughts, what these negative and unhealthy beliefs that were making her so anxious. And all that was very similar. The director will be watching me and judging me. I will get tongue tied and I will forget things. Others will think I'm stupid, and I will feel like an idiot, and everybody else can do better than me. And these are all the negative thought patterns, also beliefs that she was having. After identifying, we explored what are the better ways of thinking. And then we integrated it into her belief system through many kinds of exercises. She also got better, and gradually, of course, there are homework and stuff that they need to do. But briefly, she went through the whole thing, and eventually she could give a very good performance, very good presentation to the whole for her staff. According to Alice, many people's disturbances are caused by the rigidity they hold about things. These are called the musts, as it is describes. And these rigid beliefs hold us back in life. One is I must do well. Instead of thinking I would try to do well, if I can't do well, it's perfectly okay. I'm still a worthy person. And then you must treat me well. If you don't treat me well, I'm useless. So, but we changed that to yes, I would really like you to treat me well, but if you don't, that's fine. I'm still a worthy human being. And the third is the world must be fair to me. Everything in the world should suit me and go well for me. So that's another very rigid belief some people have. And then we change that belief to yes, I would rather the world be fair to me, treat me well. But if it doesn't happen, then that's perfectly okay. I am still a worthy human being. I can still make myself go forward in life. These are the three beliefs that Ellis always emphasizes that we should overcome all the rigidness of our thoughts, our beliefs. The more you are rigid about a belief, when the demand, in fact, when it doesn't happen, you will be disturbed unhealthily. But when you go through REBT, what exactly happens? All these rigid demands will become preferences for you. So when you have a preference, you would rather have what you want, but if you don't collapse.
I have a question here. Is this done under hypnosis during ego strengthening?
Yes. You see, the thing about CBT is that you can use it with anything. Any of the psychotherapies can be integrated and vice versa. So it can be, hypnotherapy can be integrated into it at certain points. You see, if you are trained in certain other psychotherapies, when you do this and you get well trained in this, you automatically will know where should that fit into this framework. So hypnotherapy is the same. You can do ego strengthening if you want to by integrating it. And also during the exercises you're taking through your client through, you can use hypnosis to enhance the outcomes. It goes to many other therapies. It goes to Gestalt therapy. If anybody who is doing it, it can go with psychoanalysis. It can go with even mindfulness. Any kind of psychotherapy can be incorporated into CBT, and CBT can be integrated sort of into any other kind of psychotherapy. If you are well trained, you're free to incorporate anything into anything that you do. That's a real advantage, is a real good thing, because the therapeutic outcome will be so much more enhanced.
I think it's quite important to realize that, yes, CBT, REBT, they're really effective therapies in their own right.
Yeah.
But when you bring them in, the research is just there that bringing these elements into other therapies enhances the outcome of those therapies. So
Yeah.
EMDR, for example, ego state approaches, counseling, all
Yeah.
forms of psychotherapy, you can bring
Yeah.
elements into what your prime discipline is to help enhance the outcome.
Even CBT, two models also can be used together. That means Beck's model and Ellis's model. If anyone has learned Beck's model and anyone is going to learn the REBT, they also can be superimposed and they can be done together. So, of course, you got to be trained in each of them, because everything is geared to restructuring your thoughts, bringing your disturbance down, allowing you to have a purposeful, productive life without being disturbed and getting thrown back instead of going forward. If wherever necessary you feel that, oh, this patient, now I'm doing CBT, but this patient might benefit from hypnotherapy, you can bring that, and then only when you learn it, you will know many areas you can use hypnotherapy. You can use it with ego strengthening. You can use, under hypnosis, you can recite the new effective beliefs that they already found out. You can incorporate that through hypnotherapy into your subconscious, which also again will start working through the subconscious and also by at the conscious level too. You can use it with anything. That actually is the multimodal therapy, they call it. You can use.
I have a question here. Is this helpful towards treating people with ADHD or
Yes.
autism and
Yes.
those sort of behavioral patterns?
Yes.
Like
Yeah, it depends.
smoking.
Oh, yeah. Yes, of course. And it depends on the, like, if anyone is in the spectrum, you need to see where which side of the spectrum the person is. Some people may not be able to sort of comprehend. But the social anxiety person that I just spoke is an adult ADHD client that I'm working with. Yeah, and he's improving so much because I'm using also hypnotherapy for him and also CBT and a little bit of other stuff, EMDR and stuff I use for him. But of course, you need to know if you are an expert in handling ADHD, then that's not a real problem. But if you're not, then you will have to select your clients, where are they in the spectrum? All right. Yeah.
Well, thank you, everyone. Just thinking the only
Thank you,
thing that's the end of the
everybody.
world
Yeah.
is the end of the world
Thank you
itself.
so
The only
much.
thing that's the end of this session is the end of this session itself. So thank you, Rizka. Thank you, Nasrat, for being here. Massive thank you to Dr. Sumithra. And an even more huge thank you to you all for joining us. And, I will say, look forward to seeing you on the course again. So take care, everyone, and have a lovely evening.